If you are over 60 and living with back pain, you are not alone. Millions of people wake up every morning with stiffness in their lower back. They stand up slowly. They brace themselves before moving. They hesitate before bending, turning, or lifting even light objects. Over time, this pain changes how you live. You sit more, you move less, you become careful. And eventually, you begin to believe that back pain is simply part of getting older. But that belief is one of the biggest reasons back pain stays. Most back pain after 60 is not caused by serious damage. It is not because your spine is worn out. It is not because your body has failed you. In most cases, back pain is caused by muscles that have become weak, stiff, or inactive. Your spine was never meant to work alone. It was designed to be supported by muscles that share the load, absorb stress, and stabilize movement. When those muscles stop doing their job, the spine takes on too much responsibility. That is when pain appears. The solution is not aggressive exercise. The solution is not stretching harder. The solution is not pushing through pain. The solution is reminding your body how to support itself again. And for most people over 60, you only need 3 exercises to begin that process. Not 20, not a complicated routine, just 3 simple movements that restore the body's natural support system. Before we talk about the exercises themselves, it's important to understand why back pain behaves differently after 60. As we age, muscle mass decreases faster than we realize. This happens even in people who stay relatively active. The muscles that stabilize the spine are especially vulnerable because they are not used directly in daily life. At the same time, joints become stiffer, discs lose hydration, and movement becomes more cautious. Fear plays a role too. After a painful episode, many people stop moving as much because they are afraid of making things worse. Unfortunately, this creates a cycle. Less movement leads to weaker muscles. Weaker muscles lead to more pain. More pain leads to even less movement. This cycle can continue for years. The goal is not to fix the spine. The goal is to break the cycle. And the fastest way to do that with movements that are gentle, predictable, and safe. The first exercise is walking. Walking is one of the most underrated exercises for back pain, especially for people over 60. Many people think walking is only good for the heart or weight control, but walking is one of the best ways to restore natural spinal movement. When you walk, your body moves in a rhythm. Your arms swing, your hips rotate slightly, your spine moves gently within a safe range. This motion improves circulation to the discs in the spine. It lubricates joints. It reduces stiffness. It activates muscles without stressing them. Walking also sends an important message to the nervous system. It tells your brain that your body is safe to move. This is critical. Pain is not just physical, it is also neurological. When the nervous system feels threatened, it tightens muscles and increases pain sensitivity. Walking calmly reduces that threat response. The key is how you walk. Walking should be comfortable. It should not be rushed. It should not feel like exercise punishment. Short, frequent walks are far more effective than long, exhausting ones. Even 5 to 10 minutes at a time can be powerful when done consistently. Walking after sitting for long periods is especially helpful. Sitting stiffens the spine and weakens support muscles. Walking reverses that process. Many people notice that their back pain decreases not because they walked far, but because they walked often. The second exercise is hip hinging. This is one of the most important movements for protecting the back, and it is also one of the most misunderstood. Most people bend incorrectly. They bend from the lower back instead of the hips. When the hips stop moving well, the spine is forced to compensate. This increases strain on the lower back. Hip hinging teaches your body to bend from the hips while keeping the spine supported. This movement pattern protects the back during everyday activities like sitting down, standing up, reaching forward, or picking something up. Hip hinging does not require deep bending. It is subtle. Imagine your hips gently moving backward while your chest stays relaxed and your spine stays neutral. You are not forcing range of motion. You are not stretching aggressively. You are simply reminding your hips how to move. This activates the muscles of the hips and glutes. These muscles are some of the most important back protectors in the body. When they wake up, pressure on the spine decreases. Hip hinging also improves balance and confidence. It teaches your body that bending does not automatically mean pain. This reduces fear, and reducing fear reduces pain. The third exercise is gentle core activation. The word core often scares people. They imagine sit-ups, crunches, or planks. Those exercises are not necessary and often not appropriate for people over 60 with back pain. The core is not about force, it is about support. Your core muscles act like a natural brace around your spine. They stabilize you during movement. When these muscles become inactive, the spine becomes unstable. This instability often shows up as pain. Gentle core activation teaches these muscles to engage without strain. One of the safest and most effective ways to activate the core is through breathing. When you breathe deeply and slowly and gently tighten your abdominal muscles as if preparing to cough, you activate deep stabilizing muscles. This is subtle. There is no visible movement. There is no strain. But over time, this builds support. You can practice this while sitting, standing, or lying down. The goal is not to hold tension. The goal is awareness and gentle activation. When your core begins to engage automatically during daily activities, your back feels more stable. Stability reduces pain. These three exercises work together. Walking restores movement and circulation. Hip hinging restores proper bending mechanics. Core activation restores stability. Together, they address the most common causes of back pain after 60. They do not overload the body. They do not create stress. They do not trigger fear. They send calm, consistent signals of safety. Consistency matters more than effort. Doing a little every day is far more effective than doing a lot once in a while. Back pain improves when the body trusts movement again. That trust is built slowly. Many people notice small changes first. Less stiffness in the morning. Standing up feels easier. Walking feels smoother. Fear begins to fade. Pain may not disappear immediately, but it often becomes quieter, less demanding, less controlling, and that alone can restore quality of life. It is important to understand that not all discomfort during movement is bad. Stiffness can feel uncomfortable, but is not harmful. Sharp pain, worsening pain, or pain that spreads should always be discussed with a professional. But avoiding movement completely often makes back pain worse. Your spine was designed to move. After 60, the goal is not to push harder. The goal is to move smarter. 3 exercises, done gently, done consistently, done with patience. Your back does not need punishment. It needs support. And when you provide that support, the body often responds better than you expect.